You say that breast lifting, there's a lot of art to it. That's an artistic talent.
I think there is a lot of art to breast lifting. And the longer I've been in this game, the more I realize the disparity between artistic surgeon and non-artistic surgeon. There just is. And that's one of the big displays of my art.
Okay.
And you know, so often I see the patient who comes to me and I say, I'm sorry, you're drooping and you'll need a lift. And they go down the street to Dr. X who says, oh no, you don't need a lift, you don't need the scars, let's just put a bigger implant that'll fill up the volume. And to somebody who's unsuspecting, that might sound right. But if you think about it, if you are drooping without an implant and you disconnect that tissue and you put a heavy bag in there, guess what? You're going to droop more. And invariable, I see these people back, I never wanted to be this big, and now I'm drooping to my knee. So whether you need a lift or you don't need a lift is really based on your anatomy. And if your nipple is at or below the crease, your inframammary crease, you probably need a lift. And some people need a volume and a lift, so they need an implant and a lift. And I really pride myself on how that lift goes, how the breast looks, how round the breast can be as far as the inferior pole, that the areolas are equal, that the areolas, I like smaller areolas, I like an incision that you barely, so faint you barely can see it. And my technique that I've talked to you before about is I'm obsessed with taking tension off the incision. So when
this is for minimal scarring.
Yeah, so for example, looking at a breast lift, the bottom of the breast where you wedge out, you know, where you take out tissue here, I actually wedge out a little bit of breast tissue. And what I do is I actually close, the breast tissue has a lot of structure, so I actually close the breast tissue and then the skin's just kissing. And if the skin's just kissing, there's no tension on the skin, you're gonna have a better scar. Then if I can do a microbite closure and just finally close that incision so it's almost perfect, then they have the best opportunity to have the best scar. And so if I can do that on every patient, their scars are going to be a lot better.